so I picked, since we cover so much of the concussion continuum, I really just picked one topic to cover today so I could fit it into 5 minutes and give you rich content, which is an area of research that I am most passionate about, which is driving after concussion. This seems on the surface like an obvious one, right? Like, oh, concussion is an impairment. It seems obvious that people would not drive after they sustain a concussion. But the reality is that is not true. Our clinicians have zero guidelines, zero recommendations, and zero evidence, frankly, around whether they should tell patients to drive or not to drive after an injury. And so what that's resulted in is roughly half of athletic trainers like me who tell patients not to drive and the other half not saying a thing about it. And then correspondingly, half of patients that choose to refrain from driving for some short period of time, and the other half that literally drive home from the football field that they got a concussion on or wherever they sustain a concussion. Which for anybody who takes to the roadways is a little bit startling and a little bit concerning, and obviously a large public health issue if in fact concussion necessitates that we refrain from driving. So that's really where we're at now. I mentioned that there is very little evidence in this area, and most of which we've generated here at UGA. It wasn't a talking point, and it's starting to bubble up in the concussion world as something of concern and something that people are pointing to as an issue. We were one of the first groups to document impairments after concussion on a driving simulator, and this was even in people once they were asymptomatic. So they were close to or nearly recovered from their concussion at the time we evaluated them, and still had differences in the way they controlled a car within the lane, which is a risk factor for motor vehicle crash on a driving simulator. We've since expanded that study out to look at individuals at day 2 after concussion, and then once their symptoms resolve, and then once they have full medical clearance. And those data are in review now, but they're interesting. We see the most impairments at that day 2 time point, which makes sense. That's when the symptom load is the highest, when cognitive impairments are the most observable. And so we see more differences in poorer driving performance at that acute time point. Then once their symptoms go away, in that particular study, we saw that they actually drove a little bit more conservatively. They drove a little slower, and they constrained the car within the lane a little bit more. So that shows us that they might be compensating a bit for the injury. And then once they reached unrestricted medical clearance, no differences between groups. And so that shows us a nice recovery pattern to start to lend towards the next step, which is telling clinicians that manage patients with concussion that they should at least discuss driving after concussion with their patients. We are also looking at current assessment tools that are commonly used with concussion assessment, like neurocognitive exams, balance assessments, and symptom checklists, to see if those could serve as predictors of the impaired driving in the concussion group. And the reason we want to do that is because it might be that not everybody needs to refrain. Some people after concussion have very mild symptoms, and it might be that that person's fine. Just like you might wake up in the morning and be a little bit tired, but you still drive to work, that person might actually be okay, or they might be okay after a couple days. And restricting someone's driving, as you know, really changes their independence. Like if I told you right now you can't drive for the next week, how would you get to work? How would you do the things that you needed to do? So we need to be able to balance the appropriateness of the recommendations with the level of impairment. It would be ideal if we could do that based on the clinical presentation of the person with the concussion. We just got promising word of some potential future funding in this area, and so we're hoping to expand this out to actually look at people before they get injured. So they'll have their own individualized pre-injury baseline that we can compare to in addition to a control group. And then we're hoping to look at them at day 2, day 4, asymptomatic and unrestricted medical clearance, so that we can better fill in the whole picture. And then we're also going to track their driving with GPS trackers to look at naturalistic driving. It's one thing to put somebody on a simulator, but what are they actually doing on the road? Are they safe on the road, and are they compliant with the recommendations that we provide? So that's where we're at now. We're hoping to launch that in the next year. So stay tuned. That will be a really foundational study in our field for making really strong evidence-based driving recommendations after concussion. Questions?